Did you know that you can control your blood sugar and prevent or manage diabetes using a natural food ingredient, ginger? In this video, I'll give you 6 reasons to consume ginger for preventing or controlling diabetes. At the end, I'll also tell you how much ginger you should consume daily, in what form, and at what time of the day to get maximum benefit from it. And as a bonus tip, I'll also tell you other medical problems that ginger helps with. So let's begin this health sachet video. Here are 6 different ways in which ginger helps in diabetes. The first way is by reducing sugar digestion in the intestines. Ginger blocks enzymes that metabolize carbohydrates, so less sugars get absorbed in the blood. This helps you keep your blood sugar low. So this is a benefit for diabetic patients as well as for those who want to prevent it. The second way is by increasing insulin secretion. After you have a meal, serotonin, which is a feel-good hormone in the body, increases insulin secretion. But in diabetic patients, the serotonin receptors, which are the proteins to which serotonin attaches and becomes active, are damaged. This reduces insulin secretion and causes high blood sugar. Ginger interacts with such serotonin receptors and increases insulin secretion. So this is a benefit for diabetic patients. The third way is by lowering insulin resistance. One of the actions of insulin is to help blood sugar enter our body cells to be used as a fuel. But as diabetes sets in, the cells develop resistance to this insulin action. So the sugar in the blood does not get fully utilized and stays high. Ginger reduces insulin resistance over time. This helps diabetic patients in getting their blood sugar lowered. Since insulin resistance is a precursor to diabetes, this action is also beneficial for prevention of diabetes. The fourth way is by mimicking insulin action. Ginger helps blood sugar to get into muscle cells independent of insulin. In diabetic people, insulin is scarce, so ginger acts like insulin in this role, helping diabetics. The fifth way is by lowering blood sugar directly. Consuming 1 to 3 grams of ginger powder a day for 8 to 12 weeks lowered fasting blood glucose in patients with type 2 diabetes. So this is a benefit for diabetics since they have a high fasting blood sugar. Finally, the sixth way is by preventing diabetes-induced medical complications. In diabetes, many internal organs get damaged due to years of high blood sugar levels. The main amongst them are liver, eyes, kidneys, and the nervous system. At least half the diabetics get fat accumulation in the liver, causing something called NAFLD or non-alcoholic fatty liver disease. Diabetic people also develop retinopathy, nephropathy, and neuropathy. Ginger helps prevent or delay the onset of these problems. Ginger also protects against heart problems that are caused by diabetes. This is a great benefit for diabetics. So the action points for you are: consume ginger daily for preventing diabetes. Also take it for added help in managing high blood sugar and controlling diabetes if you already have it. Make sure you consume it with your diabetes medicines and keep your doctor informed about it. If you are finding this information useful, don't forget to like this video and subscribe to this channel. Now, how much ginger you should consume for these benefits? In what form? Let's check that out. If you consume too little ginger, you get no health benefit. And if you take too much, you face problems because ginger is a very strong spice. Most health benefits of ginger are found at 4 grams a day of fresh ginger. This should be equal to a teaspoon of grated ginger. You can add that to your food. If you want to consume dried ginger powder instead, take 1 gram of it a day. If you exceed that, you may get acidity or heartburn. Now, some people do not like the taste of ginger powder. Such people can take tablets or capsules that contain ginger extract. The ginger extract is often standardized to something called 2.5% gingerol. Take a total of 1 gram of such ginger extract in divided doses. If the extract has higher concentration, you obviously need lesser amount daily. Now all this can get confusing for lay people, and so I made a separate video. This is how it looks like. It explains what these extract strengths mean. It will also help you read supplement labels better. I'll give a link to this video at the end. Ginger tea or ginger water is another option some people use. You can steep 4 grams of fresh cut ginger in water and drink that tea. Google the recipe on internet or see my video that I talked about just now. What about gingerbread and ginger cookies? Well, they have too little ginger to give any benefit, so I have them for taste and flavor, but not for health benefits. So here are the action points for you. Consume 4 grams or 1 teaspoon of fresh cut ginger, or 1 gram of dried ginger powder, or 1 gram of standardized 2.5% gingerol extract, or 4 grams of fresh ginger steeped as ginger tea. Have these over 2 to 4 divided doses in a day. Give 3 to 6 months to see the health benefits. Now, as a bonus tip, let me quickly tell you numerous other benefits of ginger. I have explained all these details in my article on the website. The link to it is in the description below. Ginger has many antioxidant compounds and so has anti-inflammatory properties. It has no gastrointestinal side effects, so it is helpful in reducing pain and swelling in many conditions such as joint pain and arthritis and muscle pain. In this aspect, it is almost as good as a non-steroidal anti-inflammatory or NSAID medicine, without its side effects of course. Ginger is also useful in bronchitis, acidity or heartburn, upper respiratory tract infection, menstrual pain and digestive problems. There are other food ingredients that also help you in controlling diabetes and blood sugar. For example, gymnema and cinnamon. You can watch this video. And as I had mentioned, to learn everything about ginger dosing, you can see this video. Don't forget to like this video and subscribe to this channel. Forward a link to this video to diabetics you know. Remember, ignorance is a bad idea when it comes to blood sugar control. Thank you.